started. Thank you again for everyone for taking the time to be here with us today. And if there are any reporters in the room, we just ask that you wait until the end of the press conference, and then we will pivot to question and answers for you. So good morning, and thank you everyone for joining us today to uplift the voices of women of color in the human services sector and call for the city budget to prioritize pay equity and invest in the essential human services workforce. And thank you so much to the New York City Council's Women's Caucus for being a champion of this cause. I'm Nayela Amaru, Policy Director of the Human Services Council, an organization that represents over 170 direct service providers across the 5 boroughs in New York State. Every day, our members deliver critical programs and resources such as housing access, childcare, elder care, shelters, food pantries, mental health counseling, disaster response, and so much more. Our workers serve as an invaluable lifeline to millions of New Yorkers each and every day. Yet, the impact of our workforce, 82% women and 80% people of color, is not valued by the de Blasio administration. Our members depend on as much as 90% of their budget from government contracts, which set the wages of their employees. This means the city is responsible for determining the wages of our workers. Over 60% of our workforce qualifies for public assistance programs. Clearly, government contracts drastically underfund the cost to provide these services and rely on low-wage workers to fill in those gaps. As a result, New York's human services workforce, a majority women of color, are paid poverty wages under contract with the city. Adding to the city's long practice of undervaluing the work of women of color, the de Blasio administration deepened economic pain by breaking a promise to support the indirect cost rate, a crucial funding initiative to the human services sector. By cutting the indirect cost rate, nonprofits were thrown into peril, resulting in layoffs of women and people of color, and increasing an already intense workload for human services workers at a time when government support was needed more than ever. During the COVID-19 crisis, human services workers were not provided PPE, and the small cost of living adjustment provided to them on city contracts expired without renewal in last year's budget. We cannot stand by and allow budget gaps to be bridged on the backs of Black and brown women who were already at a breaking point. Our city must stop exploiting the chronically overworked and underpaid workers of color and provide this essential workforce with tangible support. Equity must be at the center of our COVID-19 response, and recovery means supporting human services workers and the communities they serve in the fiscal year 22 budget. Today, we will hear firsthand the lived experiences of women of color who have been directly impacted and deeply harmed by the city's unjust contracts for the human services sector. These are their stories, and these are our champions. Our first speaker today is Councilmember Adrienne Adams, member of the Women's Caucus. Councilmember, please unmute your mic. Thank you.
Thank you so much, Nyla. It's great to see you this morning. Good morning, good morning, good morning to my friends at the Human Services Council. I'm Councilmember Adrienne Adams, and I bring you remarks today as a proud member of the now 14 membership of the Women's Caucus of the New York City Council. Good morning as well to all of our wonderful, faithful advocates this morning. I represent the 28th Council District in Southeast Queens, and I join everyone here in demanding that we invest in our city's human services workforce. These employees work in childcare, elder care, housing, food pantries, mental health counseling, and so much more. Women make up 82% of this essential workforce, and people of color constitute 80%. but they've seen a loss of 40,000 jobs since last February. That is wrong and that is unacceptable. The COVID-19 pandemic has severely impacted women, especially, as Naila said, women of color who do this important work in our city. Women are 4 times more likely to drop out of the workforce because of this pandemic. While schools were closed, many women had to reduce their hours or leave together to care for their children. And even those who stay in the workforce are paid much less than men who do the exact same work, by the way. We must change that immediately. As we begin to recover from the pandemic, our city must truly value the labor of women. Some of our human services providers receive as much as 90% of their budget from government contracts. So the city must ensure that workers are paid fairly. If we want a just recovery, we must center the human services workers who play an essential role in our communities and make sure they're paid the wages they deserve. Fair play not only helps women in the workforce, but it also strengthens families, our communities, and our city as a whole. And guess what? In other words, it's good for business. It's time that the city step up for these women who have stood on the front lines of the pandemic and have helped all of us during this difficult time. I stand united as always with the Human Services Council, the City Council of the Women's Caucus, and everyone who is fighting for equity and fairness for our essential workers. I apologize that I have to leave you, but I do chair the Public Safety Committee, and those of you that are following know what I'm up against today. So bless you all for your hard work. I will always be in your corner. Let's continue the good fight for the women of the city of New York, and let's get equity out there. Thank you so much.
Thank you so much, Councilmember Adrienne Adams, for your constant support and supporting the Black and Brown women of New York City, and for your call to invest in the human services sector. We always appreciate your advocacy and support of our cause and for the women of the city. Our next speaker will be a frontline speaker, Sandra Escamilla Davies, who is the Executive Vice President of the Children's Aid Society. Sandra, please unmute your mic.
Thank you. Good morning, everybody. Thank you to the Women's Caucus, City Council members, and the Human Service Council for this opportunity to stand with you today. My name is Sandra Escamilla, and I'm the Executive Vice President of Children's Aid. And while I'm here on behalf of Children's Aid, my identity as a woman, as a Latina, and daughter of working class immigrant parents who worked in New York City for decades is ever present this morning. Children's Aid currently serves 50,000 children and their families annually at every stage of development, from cradle through college and career, and in every key setting: home, school, and community. The team serving these families is 2,000 strong, and the majority of our team, over 75%, are women, and of those women, 86% are women of color. It's been a little over a year since the city was shut down due to COVID. And I have to tell you that when I look back, and I continue to be in awe about the ways in which our staff and staff from other CBOs, mostly women of color, have stood in the gap and provided services and support to families who have been hit the hardest from this pandemic. Because of their efforts, we have been able to be responsive to the needs of our family in real time, and specifically tend to the essential needs of our families. When our families lost their jobs and stores shuttered, requests for food assistance more than doubled. By December, the staff that we work with, the women, were able to distribute more than 83,000 boxes of food, meals to families in need. We kept our clinics open, as well as moved to provide telehealth services, which is something that became vital to our communities. We transferred our foster care family visits to virtual, but continued in-person visits to promote child safety. And we provided loving homes for those children who required placements into foster care, and in some cases, after losing a biological parent to COVID. We stayed connected. Our staff stay connected. One-on-one check-ins was something we did on a regular basis. We called families to assess their needs, from food needs to remote learning to PPE to health to mental health, because things change rapidly, as everybody knows. A family was not in need on Monday, and by Friday they needed all of our services. And all of this incredible work would not have been possible without our workforce, who I will continue to highlight are women, women of color. Their commitment to our communities and families is unmatched. Yet, despite our staff's incredible efforts throughout the pandemic, our organizational viability and that of others has been rocked by the number of cuts we experienced over the last year, a year in which our families had the most pressing needs. The city announced devastating cuts to youth services and education, cuts to our indirect cost rates. Last year's cuts to indirect costs cost us $1.2 million. And this year we found out that we're getting only 30% of what was promised for our indirect costs, which will cost us another $890,000. That's a lot of money. City contracts are nearly 1/2 of our total budget. That has a direct impact for our workforce and our programs. So let me paint the picture for you. The human service workforce is predominantly women, women of color. We can't make these devastating cuts because they impact them. They impact these women professionally and then personally, because then they cross that delicate line from being our staff to being our clients. The cuts I just mentioned have resulted in our failing our workers. I personally, along with my team, furloughed over 250 workers, people, mostly women, Black women, Indigenous women of color. This was just in the fall. I can't overstate how desperately we need these women, these workers in our recovery efforts. We need their talents, their ingenuity, and their strength to help our families get back on their feet. We have to do better. We can do better. This is the time for the city to stand up for children, for youth, for families, by protecting the funds for programs that support them and the non-for-profits that are playing a critical role and will continue to do so in the recovery of our beloved city. Thank you so much for your time.
Thank you so much, Sandra, for sharing your story with us here today. Our next speaker is Councilmember Gibson, who is co-chair of the Women's Caucus. Councilmember, please unmute your mic.
Thank you so much. Good morning, everyone. Thank you. It's an honor to be with all of you this early Thursday morning. I hope everyone is healthy, well, and safe. I am Councilmember Vanessa Gibson of District 16 in the Bronx. I'm proud to serve as co-chair of the City Council Women's Caucus, along with my amazing colleague and co-chair, Councilmember Farah Lewis. My pronouns are she, her, and hers, and I thank all of you for being here today. Thank you to the Human Services Council, my Women's Caucus co-chair, Farah Lewis, my colleagues who have joined the call, Councilmember Dharma Diaz, the chair of our Committee on Women and Gender Equity, Councilmember Adrienne Adams, and Councilmember Helen Rosenthal, as well as recognizing all of our partners at the Children's Aid Society, Urban Pathways, Sheltering Arms, VIP, Mujeres, and Goodwill Industries of Greater New York and New Jersey for joining us today for this very important virtual press conference. Normally, we would be on the steps of City Hall, but I'm truly thankful for all of you. Human service workers are truly on the front lines, supporting our residents and families and communities in our city every single day, but unfortunately do not receive a livable wage for your work. Many of our workers are women and people of color who live far below the federal poverty line and struggle to make ends meet every single day. New York City, sad and unfortunate, has a very long history of underfunding human services, a sector where 82% of its workers are women and 80% are women of color. This underfunding, unfortunately, has resulted in an average annual income of $32,000, making it the second lowest paid labor force. It is time for this to change. Our conversations in the City Council and the Women's Caucus about pay parity, gender equity, must include human service workers who are too often excluded despite doing essential work in our city, especially over the last year during COVID-19, this global pandemic. We must call on this administration in our last several months to take steadfast action in addressing this wage crisis. It is a crisis, it is a call to attention and a call to action. I want to thank Anayela. Thank you so much. You've always been in the trenches. Thank you so much for being an incredible woman of courage, commitment, conviction. Thank you for wearing that S on your chest because you are a super woman And we thank you for organizing today's press conference. Thank you for your advocacy and demanding that we hold the city accountable for paying women workers what they deserve. And it's really ironic that this is Women's History Month as well, when we celebrate and recognize all of our female first responders, essential workers, frontline staff, everyone that has been out in the trenches, our healthcare sheroes. Just yesterday, we are recognized as Pay Equity Day across the state of New York. So there were so many efforts from city legislators, state legislators, all of our not-for-profits, all of our human service workers, and we want to thank you. We see you out there. We salute you for all the great things you're doing. Everyone is doing something, no matter what title we have in front of our name, and your work does not go unnoticed and unrecognized. So I want to thank you on behalf of my community in the Bronx, the Boogie Down Bronx, for all of the great work you do every day. I have been out there with many of you, serving food, giving out PPE, making sure we remind seniors that they're not alone, doing home visits, knocking on doors. I'm out every day in these streets. I'm out today. I'll be out this afternoon serving food. But that's exactly what we do as women, no matter what. And as undervalued and underappreciated as we sometimes feel, we still do it anyway, because that's exactly what we are called to do. So I just want to express my support for all of you, all of our human service workers in the industries. Thank you so much for everything you do. Please know the City Council stands with you, the Women's Caucus. We are now a fabulous 14 because we now have a new member in Councilmember Selvina Brooks Powers from the great borough of Queens. So we are just growing in numbers and I am so excited. Women taking over, it's our time. Let's claim everything that we rightfully deserve and accept nothing less than the best. And you know why? We are not doing this work for us. We are doing this work for the next generation of young people, our young queens that need to see us in leadership and know that we stand up for them and their future. So thank you so much for today's important press conference. You have our support. We stand with you. Women rock.
Councilmember Gibson, as always, thank you so much for being such a powerful voice and advocate, not just for the Bronx, but for all women across New York City, and for always using your platform to center those of us who are invisible, dismissed, ignored, undervalued, overworked, and underpaid. And again, just thank you so much for, again, adding your voice to this conversation today. We thank you for all that you do in the Women's Caucus and are so deeply grateful for your leadership. Thank you, Councilmember.
Thank you.
Thank you. Our next speaker in today's conversation is Leela Daughtry, who is a direct frontline case manager for the 105th Street Safe Haven at Urban Pathways. Leela, this is your moment. Please unmute your mic. Thank you.
Good morning, everyone. Good morning. My name is Leela Daughtry, and I'm a case manager at Urban Pathways. I work at a safe haven program contracted by the city, serving individuals who have experienced street homelessness. These individuals have been failed by the social safety nets and government systems meant to help them. They have experienced the traumas of foster care, incarceration, and homelessness. And most are living with mental health concerns. To meet their needs and help them regain trust takes a lot of energy and compassion from staff members like myself. The work I do is extremely challenging and is made even harder by not having enough resources or staff to provide my care for the clients due to lack of adequate funding. I regularly wear multiple hats. While I signed up to be a case manager, I'm also acting as a housing specialist and a part-time cook. I fill these extra roles because I care deeply about my clients' well-being, but it is draining that the government has underfunded the nonprofit sector. My wages do not match the essential nature of my work, the extra roles I play, nor the additional challenges presented by the pandemic. On top of the health and safety concerns related to the COVID-19 virus, my clients also face increased concerns related to their mental health and substance abuse disorders that were made worse by the effects of isolation. Many clients were not able to access the psychiatric care they needed due to services closing or becoming virtual, and our clients had limited access to technology. I find myself having to respond to crisis more often and fill the gap in client services. While we receive emergency pay for a period of time, I was also funded by the city until June. Only a handful of organizations had access to it. The majority of the workforce never receive emergency pay at all. In the increased cost of groceries, cleaning supplies, and extra expenses, that pay hardly made a difference. My low wages make it hard to build savings. And I mean, I work paycheck to paycheck to support my family. I wish the government would invest in the human service workforce the same way that we invest in our clients. Without us, these services would not exist. Without me, my clients would not receive the compassion and care they need to heal and regain their housing. If the city is going to name the human service workforce as essential, they must raise our wages and match the work that we do with them. Thank you.
Thank you so much, Leela, for those incredibly powerful remarks and the truth that you just said in terms of we need to have government invest in the human services workforce the way that you and your coworkers each and every day invest in your clients. And that's why we're here to have this conversation today and to remind government and the de Blasio administration to do just that. Thank you again for sharing your story. Our next speaker in today's conversation is Councilmember Darma Diaz, who is chair of the New York City Council's Committee on Women and Gender Equity. Councilmember Diaz, please unmute your mic. Thank you.
Good morning, powerful beings. I am definitely in a happy place around you all today. I hold a BA in Human Services, and prior to coming onto the council, I worked in the shelter system for 13 years. I come from a family of human service providers, my sister, my daughter's grandmother, my nephews. I share it to say that I'm with you 100% in the fight. Well, I've been in the council, I've been fighting for gender equity. I've had conversation with the administration over Department of Homeland Services. I like to see victims of domestic violence, their time extended in the shelter system. I truly believe that 6 months is not enough for us to reset ourselves and become as productive as we would like to be. I've also taken on sanitation issues, and the reason why I've taken on sanitation issues is because I believe, I'm sorry, I'm in another call. Sorry guys, I'm juggling, but it's that important to me to be a part of your process today. The reason why sanitation has been important to me is because we want to have a clean, safe community. We want to make sure that when our little people, our children, open the doors, they see something positive. Right? The same way we work with our children to do their dishes and pick up their toys, I'm in a place where I feel that society needs to be a part of that process. So whether it's cleaning up the streets or assuring that the MTA is on time, those are the simple things that are important to me. During the pandemic, the majority of it, I worked at the shelter system. I made it my business to show up to work every day. Why? Because I knew that my families needed me. When one becomes a human service provider, you give yourself 150%. So to that, in closing, I say thank you for all of you that have chosen to be human service providers, and feel free to count on me. If there's a situation outside the box that you need to be championed, count on Darma Diaz from the 37th Councilmatic District to be a champion. Gracias.
Thank you so much, Councilmember, for taking the time to be here with us today. And our next speaker in today's lineup is Kamini Pierre, who is Director of Preventive Services at Sheltering Arms. Kamini, please unmute your mic. Thank you.
Thank you, Nayela. As Nayela said, my name is Kamini Pierre, Preventive Director at Sheltering Arms. Thank you so much to Human Services Council, Women Caucus, and council members for having me here at this wonderful forum. Everyone, you're just amazing, amazing women. Happy Social Work Month. That's number one. Happy Women's History Month. So thank you all for all your hard work. I want to start with first letting everyone know that I've been a human services professional for over 19 years. I've been with Sheltering Arm for the past 10 years. My start of my career was as a child psychotherapist. So I've always worked with children and absolutely love it. I came into child welfare just about 10 years ago. And the reason why I made this jump was to really enhance my career, because I had an opportunity as a director at Sheltering Arms. At the time, it was a different name. But currently, I'm a mom of two. I have to say that that was the decision that made me make that jump, because it just was really hard managing the schedules. Just listening to Leela talk, I remember just being a direct worker and working crazy schedules and just having to run home and sometimes leaving my child with my mom because, you know, it was just very difficult. And so I have to say I took the position, but in taking this position, it was so difficult in the sense that I went from being a frontline therapist to actually becoming a director with only a $2,000 increase. Okay. And that was hard, and I also left the union job to take this position. And it was hard, but I needed to advance my career. And so I did that, and I'm happy. So prevention. I landed my feet in prevention, which I absolutely love. I have to say that if for those who don't understand, are not aware of prevention and prevention services, we really work hard with the Administration for Children's Services, or a contracted out provider, where we are able to go into homes and just help to promote the safety and well-being of children. So I want to say with Sheltering Arms, we are made up of 73% women, 82% Black and Latinx. And in prevention alone, we have up to over 90% women. And so at the onset of this pandemic, it was interesting because we did continue telehealth, but we also had to do home visits because, as everyone stated, we had to provide PPE. We had to provide emergency food supplies. We had families that didn't have had that special cultural dietary needs. And we had to go to specific grocery stores, sending out our case managers, all by the way, are women out in the field. They're dealing with COVID that's at home, dealing with losses in the family. Our agency also experienced some losses of workers. It was difficult. It was a difficult time for us. And actually, it still is a difficult time for us. And then we worked with our families. These women went out to these homes, in addition to providing in-home counseling, dealing with families who are receiving ACS cases, struggling with accessing food, cleaning supplies. Again, I said PPE. We had children that didn't have access to laptops because the Board of Education did not have an abundance of iPads. So we were able to have access of laptops, send our workers out, went into the home, print out packages in the offices to provide to these children so they can complete if they didn't have Wi-Fi. When we did access laptops, we went into the homes, showed them how to access the laptops, and then also help them access Wi-Fi because that was difficult. There were some families who were difficult, they couldn't read, right? And so we had to find ways, innovative ways, to help their children and help them. Most recently, we've increased our home visits just to improve the quality of care. We just want to make sure that our families are receiving the services. And it's interesting because when I ask my frontline workers, you know, how they're doing, they're just more mainly concerned about their families and how their families are functioning, and if their families have food, and if there's enough access to the vital necessities that they need. And so with that said, I just really want to urge everyone to understand that no COLA in the budget will not only undervalue human services worker, but it's undervaluing women. Thank you.
Thank you so much, community, for sharing your truth with us today, and again, just reiterating the personal sacrifices that you co-workers and human services workers across the sector have had to make and do every day in service of fellow New Yorkers, because of the budget cuts and budgetary decisions government has made. So thank you for taking the time to be with us here today. Our next speaker is going to be Kelly DeGracia, who is manager of the Safe Dwelling Program at the Violence Intervention Program. Kelly, please unmute your mic. Thank you.
Hi, good morning. Good morning, everyone. It's a little early. My name is Kelly DeGracia. I am a Panamanian born in Washington Heights, New York City. As a young woman, I moved to Costa Rica for about 3 years, and I came running back home to New York after experiencing some abuse in my relationship. So when I graduated college, I knew I didn't want to do work in the domestic violence field. So of course, I'm here by mistake, but I thought it was gonna trigger all the trauma and healing that I had done. I wasn't getting any callbacks, any interviews. So VIP was the first place that offered me an on-call position as a per diem for the hotline. I quickly moved up to part-time on the hotline, but that wasn't enough for me to cover any expenses for me and my son. I got a part-time job for a restaurant to make ends meet. I was walking to work 45 minutes to about an hour just to save like Metro card fare to make it work. Over the last few years, I moved up to counselor advocate for our emergency shelter. We service domestic violence survivors. And now I am the program manager. And, I reflected on my own experience and how I was alone when all those things happened to me and I didn't really have anyone to turn to, somehow you feel embarrassed about it, etc. And I kind of felt like I didn't want the people we were seeing here come through our program feel like they were alone as well. So that was one thing. They say that for you to be in this field is because you want to, not because of the pay. And man, whoever said that is very much correct. I've had to depend on my mother, who is getting older, to watch my son, pick him up from school, because I can't really pay for after school. There's been many times I worked overtime shifts because I need the money to be, to provide for my son for, whatever he asks for, not whatever, but, and I would like to provide those things. And it's disheartening to have to tell him, like, I can't get that for you. And not because he did anything wrong, but, because I'm broke. Now I became manager of the emergency shelter program during the pandemic, and, big time. Now it's managing the worry and the fears that come along with my amazing team of women. Their fears of their family and, now the client's fears, and we're all battling and trying to stay safe from this virus that we don't know that much about. We still don't know that much about. We're just hearing all types of stuff. And over the last year, it's, we still came into work every day. We never really did remote work because, people were like, I don't have benefits. We need stuff from the food pantry, diapers, formula. And, there's been certain processes that have been put into place for if someone gets COVID and they need an isolation unit, and those are all good things on paper. But once it happens, since this is all brand new to the entire world, you start seeing things that fall through the cracks. There was this one client, they found her in isolation unit at midnight. She was positive. I ran out to Queens to go get her some, take her food, to find myself seeing that she didn't have anyone to translate for her. Her daughter couldn't translate certain things for her. So I'm like, man, but she's like positive, but, I'll sit on the other side of the room and, translate for her, because if not, how are they going to understand what she needs? Like, simple, not even simple, but things like that. There have been so many moments like this for my team and I, where we've supported clients experiencing not only the crisis of domestic violence, but the crisis of homelessness and now COVID. And responding to these crisis situations is hard enough. And then you have to add the layer of fear for your own safety and for the health of your family at home. And even under the circumstances, frontline work with homeless survivors is emotionally demanding work. Many of us are survivors ourselves, working through our own trauma. Since the start of the pandemic, we have seen an increase in domestic violence incidents, worsening economic conditions, greater mental health challenges for the most vulnerable survivors. I know firsthand, working with survivors, that financial security is key to increasing safety and healing. And that means providing financial security for the people supporting the survivors. Our essential and life-saving work is more important and needed now more than ever, and we deserve decent pay for that. What we deserve. As the city and government officials work to develop a COVID-19 recovery plan, frontline essential workers, who are primarily women of color, need to be centered, uplifted, and well compensated for the work that we do to strengthen and heal our communities. We have always been essential. Thank you.
Thank you, Kelly, so much for sharing that. And you're absolutely right in the reality that so many human services workers, particularly, Black and Brown human services workers, deal with every day, personally, of trauma, compounding trauma, and still investing everything that you hold into service of your clients, in spite of, again, the decisions that government makes to cut budgets at the expense of what you and your coworkers deal with every day. So thank you for sharing your story. Our next speaker in today's lineup is Sharif Ferguson Cousins, who is the Assistant Vice President of Workforce Development at Goodwill Industries. Sharif, please unmute your mic. Thank you.
Good morning, everyone. I think just listening to all the stories that went ahead has me a little teary. But my name is Sharif Ferguson Cousins, and I work for Goodwill Industries of New York and New Jersey, a nonprofit that I believe is known by most of you here because it has had a long history of working with and uplifting some of the most vulnerable New Yorkers, peoples with disability and barriers to employment. I don't think that anyone would deny that the work that we do is important. It's a kind of work that when you stand from the outside looking in, it makes you warm and fuzzy. It pulls at your heartstrings. It's a kind of work that allows you to sleep well at night, knowing that there's an organization that is taking care of the most vulnerable New Yorkers. But let's talk for a minute about two things. Who are the people that actually do this work? And two, how much does that mission really cost? So who are they? Goodwill's human service team is made up of upwards of 70% women of color. Everyday New Yorkers, they're women who have studied, made sacrifices, has or are raising families, women who have dreams and aspirations, and women who love the work that they do because the stats shows that the compensation they receive does not equate to the value of the work. I'm going to quote WPTI's recently released Voices from the Frontline, in which they address issues related to the pay, healthcare, and other benefits for these workers. It discussed the low pay of these workers relevant to their education levels, many of whom has at least a bachelor's degree. Human service workers are called essential because we help New Yorkers get back to work, and helping to retain employment is applauded. But the city stats show that outside of restaurant workers, this group is the lowest paid group of individuals. City contract funding does not allow for living wages that equate to the value of positively impacting someone's life and inherently the lives of the people around them. So what does the mission really cost, and who foots the bill? Every contract generates costs that are sometimes never billed for or never recouped. Staff going above and beyond on their own time servicing clients, to programs not being reimbursed for things like haircuts, which are not deemed a job readiness activity. But we all know it is important when someone is expected to put their best foot forward. Having indirect costs cut in the middle of this pandemic, where providing services to vulnerable New Yorkers are our priority, it leaves nonprofits like us holding the bag. Employee wages are tied to contract dollars. The only raises most of our human services workers receive is through COLA payments. How can we cancel cost of living wage increases when cost of living doesn't remain stagnated? Cutting funding and indirect costs to nonprofits forces us to cut staff who are one paycheck away from being the clients they serve daily. Staff who forfeit paying for health insurance for a couple extra dollars of take-home pay. Cutting contract doesn't save taxpayers money. It impacts the most vulnerable New Yorkers. During this time, vulnerable New Yorkers need services now more than ever. Decreased funding means increased workload for an already underpaid workforce. We are New Yorkers, We can and will get through this, but only when we all work at being better than this. Thank you.
Thank you so much, Cherie, for sharing your story, and so powerful. Indeed it was, especially again, driving home the literal and figurative question on what does the mission really cost us and who is really footing the bill? Again, which is why we are here today, because the mission is really costing so much on Black and Brown women who are the ones footing the bill. So thank you again for sharing your story with us here today. So what we are going to do is really just, again, just create space and hold this moment to thank, everyone, the council members and the frontline workers who have shared their truth with us today. And again, for the Women's Caucus for amplifying these vital calls to action. All New Yorkers need to step up and fight for the essential and often exploited labor of women and people of color who are paramount to our city's ongoing COVID-19 response and recovery. The city must stop perpetuating gender and racial inequities by investing in the human services sector. HSC, the Human Services Council, is pushing for 3 things. 1, the restoration of all damaging budget cuts to the human services sector, including the indirect cost rate funding initiative. 2, for the city to bring back the cost of living adjustment for city contracted human services workers. And 3, to use funds from the federal stimulus to provide comprehensive emergency pay for our workers retroactive to when the stay-at-home order was put into place last March. Thank you to council members Gibson, Diaz, Adams, and I saw Deputy Majority Leader jump in. And a special thank you to our workers who were first-time press conference speakers with us here today. Thank you to Sandra, Leela, Kamini, Kelly, and Sharif for sharing your truth and joining us here today. We will now move to the question and answer portion of the press conference. I saw that we had some press on the call. So if you are a reporter, please unmute yourself and ask your question. Again, if you are a reporter and if you have a question, please unmute yourself and ask the question directly. Okay, we have reporters, but they're shy today. So with that said, this concludes our press conference, amplifying the voices of women of color whose lives, communities, and the clients they serve have been impacted by budget cuts and inequitable contracts, and the need for the city to invest in the human services workforce. Thank you again, everybody, for being with us here today. Stay safe and be well. Bye-bye.